Hello and welcome back to the Declutter podcast. I am your host, Fallon Jordan, and I am so excited. And if you've been following me for a while, you never know who I'm going to have on and what we're going to talk about, but it's going to be amazing. And I'm so grateful to have Dr. Ellie Campbell here. And we are going to be talking about her 33 years of expertise as a board certified family doctor, integrative medicine doctor. But what we're really going to focus on is her amazing new book about blood pressure, because as you know, that's a common issue that we don't really, I don't really think about it, right? Because I go to doctors like you, but like there's a lot of people who just, you get the blood pressure taken, you get conversations around medications, and it's just this whole slew of things that if you're here, like there's so much more that's going on. And so I am so delighted to have Ellie. I really just want you to dive in and like tell us about your book and how this all came to be from, you know, getting, I wanted to say getting your doctorate, but like you've evolved so much as a physician. And I also think that is what people need to hear too, is that you're a lifelong learner, right? Like you go
I am
mushroom
a lifelong
hunting.
learner,
Yeah,
for
you go
sure.
mushroom hunting and you study mushrooms for fun. Like,
Yeah, I do weird things for fun. Thank
yeah.
you so much for having me. I hope that this time we spent together gives your audience some new things and different things to think about connected to their health that maybe they didn't before. I like to think, blood pressure seems pretty boring. I mean, I think, we all go to the doctor, we get our vital signs checked. Most doctors check your blood pressure wrong. I was checking blood pressure wrong before I started studying to write this book. And I was shocked to realize that there were 7 major rules and I was violating 4 or 5 of them. And I was checking blood pressure
Wow.
in my office. So we were not standardized properly and not getting the most optimal readings for our patients, probably falsely diagnosing some with hypertension when they really didn't need to be. But I think it's important because the last 9 years or so of my career have been spent focused on cardiovascular risk reduction. Heart disease is the #1 killer in our country. More women and men die from heart disease than any other cause. 10 times more women will die from heart attacks and strokes than die from breast cancer. And yet we've got this whole marketing campaign on our boobs, right? And we got this whole fear that they put in us that we need to worry about our breasts. And yet 10 times more of us will die from cardiovascular disease. And it just doesn't really get the attention. We know that there are known risk factors for the development of a heart attack, and we think about those, as being things like high blood pressure and high cholesterol and smoking and diabetes and sedentary lifestyle. But hypertension, high blood pressure is often the first warning light on your dashboard that there's a metabolic problem that's starting to brew that could put you down a path of increased risk for a shortened life expectancy. And if you pay attention to that warning light and come see an integrative practitioner, we're going to talk to you about all sorts of things that you can do to reverse that path, to get off that direction that you're headed and go to a healthier lifestyle. And that won't involve drugs at the beginning. Whereas if you see a conventional doctor and your blood pressure is elevated, they'll likely say 2 things. You're too fat, you eat too much salt. Oh, and then by the way, here's a prescription for a blood pressure medication, right? And in reality, obesity is not as much a contributor to hypertension as we would think. Toxicity is, but just carrying extra body fat is not necessarily a problem. And a smaller percentage of people are salt sensitive than we ever really thought, because they don't do the actual test to see if they are sensitive to salt. And they're usually deficient on magnesium and potassium, which makes them highly sensitive to sodium. So we replete the deficiencies, and now they can eat all the salt they want, and their blood pressure doesn't get affected by it. So that warning light of blood pressure is a really important strategy. So over the last 9 years, I've been working hard to reduce the risk of heart attack and stroke in my patients. And I'm very proud to report to you that we now have 9 years, 0 heart attacks, 0 strokes in any patient who follows our program. And
Wow.
during the COVID pandemic, we had exactly 0 deaths and 1 hospitalization for the entire pandemic. So
Wow.
why is it? How is it that we can get these good results? And the reason is because we focus on the underlying root causes, right? We look at the reasons why people suffer from oxidative stress, from inflammation, from insulin resistance, and we work very hard to correct those things. And when we do, we reduce their risk. And it's amazing. And we watch over time. I do an ultrasound test of their neck arteries to look to see, is there plaque and inflammation growing over time, stable, or shrinking? And I just, we had a screening day in the office. We did 16 patients in one day, got their necks ultrasounded. I just got their reports back. 15 out of 16 reduced their inflammation or the plaque in their arteries shrunk. One did not. And he's not my patient. He's the spouse of a practice member.
Wow.
So all of our patients showed improvement over time, that we're reducing this inflammation. And so I think that patients need to be empowered and know that they have the power to make these therapeutic lifestyle changes. They have the power to collect the data, to know what data to look at so that they can make changes and watch those parameters improve over time. And as that does, so improves their risk, and they don't have to suffer a heart attack or stroke. I believe that heart attacks are optional and strokes are stoppable, and dialysis is not your destiny if you're willing to get the tests and do the work.
Absolutely. Yeah. I love that you shared it in that lens because I'm sure a lot of people are still kind of like picking their jaw off the floor from some of the things that you shared because these are like you're measuring the same stuff at first, right? And then you're digging deeper. And, especially for someone like me, right? Like I'm 39, like I've never really worried about my blood pressure. No one's ever talked to me about my heart health. But when you start sharing the statistics, it's like, oh, wow, like this is probably something that needs to be on my radar. And I loved the analogy of the first light that comes on in the car because I'm that person. The first light comes on, like I'm immediately going to the mechanic, like, I need you to come look at my car right now because
Right.
something is wrong with my car. So I would love to know more about like just the neck thing. That's so cool. I didn't even know that was a thing.
Yeah, so the test is called a carotid ultrasound with CIMT measurement, and that those letters stand for carotid intima media thickness. So if you think about an artery like a hose, and blood flows through the middle of the hose, the wall of the hose, the wall of the artery has a cell lining and a muscle layer, and in between those is what's called the intima media space. When plaque forms in an artery, more than 99% of the plaque forms within the artery wall itself before it ever erupts into the space where the blood flows, making a little speed bump that'll change the flow of the blood.
Mm,
When a patient has a sudden event, such as a sudden heart attack or stroke, it's not because cholesterol suddenly fills their artery and forms a plug like in your sink when you poured grease down it and it suddenly clogs up. That's not what happens. In fact, it is a very complicated orchestration of inflammatory white blood cells, inflammatory cytokines, tumor necrosis factor, white blood cells, and corrupted cholesterol, not regular cholesterol. Well-behaved cholesterol is good for us, but corrupted cholesterol, when it's oxidized or sugar-coated or the wrong shape or size, it gets stuck in this inflammatory goo. And often mouth bacteria are there along the way, making more and more inflammation. That neck artery is very close to your jaw. It doesn't take very long for those mouth bacteria to get in that artery, start causing trouble. What happens is the plaque ruptures like a volcano erupting, and a blood clot forms around that. Suddenly it goes, oh no, we got cholesterol, white blood cells, and goo leaking into our bloodstream. This is not good for us. Call the rescue, call the platelets, call the red blood cells, everybody to the rescue and stop that leaking goo. And if the blood clot that forms like a scab to seal that eruption, that rupture, if that blood clot is large enough and it occludes the whole artery, suddenly all blood flow stops. and everything south of that tissue, south of that clot, ends up necrotic, ischemic. It doesn't get blood supply. If that happens in your heart, we call that a heart attack. If that happens in your brain, we call that a stroke. Let's talk about heart attack for a second. If you're a dude and this happens to everybody at work, at home, at church is going to know it because it's very dramatic. The guys grab their chest. They're squeezing with chest pain, and they have a terrified look on their face, and they're red as a beet, and the pain is radiating down their left arm or into their jaw, and they're short of breath, and they break out in a cold sweat, and they're pouring sweat down their face, and they're nauseated, and they might even throw up on their shoes, and everybody recognizes chest pain, shortness of breath, cold sweats, nausea. We're calling 911. This man is having a heart attack. But what happens to a woman when she has the same exact blood clot happen in her arteries? Not dramatic. She goes, I don't feel very good. I'm just a little short-winded. I feel really tired. I think I need to go lie down. I'm a little queasy. I might be having heartburn. And if I stand up, I'm just a little bit dizzy. And I have a weird crick in my back or maybe in my jaw. I just don't feel well. I think I'm going to go lie down. There's not the dramatic sweating. There's not the dramatic crushing, squeezing chest pain. There's not usually significant short of breath. It's mild shortness of breath. It's like I used to be able to vacuum this whole living room in 15 minutes, and now I have to stop and rest because after 1 minute, I'm too short of breath. Those can be heart attack symptoms in women. They are not identified by the patient, by the 911 emergency crew, or even by the emergency room staff when she gets there. Wow. And so I will send you a handout that I created, a little 1 page or 2 page, I think it is, handout about these symptoms, so that I want every woman to cut that one part out and stick it in their wallet, so that in the event that she has shortness of breath without chest pain, fatigue, nausea, dizziness, and a weird pain in her back, neck, or jaw that's new, that she's never had before, that happens in a cluster of symptoms, that she can show that to the 911 emergency crew when they show up at the house and or the hospital emergency room staff and say, I think I'm having a heart attack because women don't have the typical symptoms of men, and these are my symptoms, and they all match what women typically have. And I think it's so important that we recognize these differences because in the hospital, on average, men will be taken from the emergency room to the cardiac cath lab to have their procedure to find that blockage within 83 minutes of their arrival at the front door of the hospital. For women, it's 95 minutes. We get a delay in care because we're not taken seriously. We need to learn to advocate for ourselves unless and until the medical profession catches up with us, right? It's just a delay. I think there's a 20-year delay in the scientific literature catching up to the medical staff. We know that most of the literature on cardiovascular disease was published on men up until about 20 years ago. Mm-hmm. So everybody learned about men, everybody studied about men, and everybody just assumed that women would be little men. And it's not true. We have different symptoms and we present differently, and our outcomes are much worse. We do not fare as well. We have smaller hearts, so that when we do have a heart attack, more damage is done. And our 30-day mortality is twice as high. Twice as many women die within the first 30 days after a heart attack than men. That's terrifying, right?
Yeah.
And you mentioned, Fallon, that you think we don't talk about heart attacks in women as much because perhaps women aren't having second heart attacks as often. They died from their first one, right? Yeah. So we talk about the dudes in our life who already had one heart attack and we're going to try to not let them have another one, or they've had 2 heart attacks already, or they had 1 heart attack and some stints. Well, women often don't survive long enough to need those other interventions.
Well, and the way the symptoms for women, I mean, I know for myself and people I've witnessed, like they had an anxiety attack that seemed much more quote unquote severe than what you're sharing. And I'm so
Yes.
grateful for this little handout that everybody can print and laminate and put in their wallet or on the back of their iPhone or whatever, so that you have this information, because the more we learn about men versus women in the healthcare field, the more that we have to have these conversations, because I'm like still like boggled by like the statistics. And it is because not many women have a heart attack and then live to tell the tale. Like it's not something that we talk about. We're not, I talk to people all day about stroke recovery, but
Right.
like that's such a very different thing than what you're describing. And I'm sure a lot of people right now are having those aha moments as well.
And
And
it is hard because anxiety can cause many of those same exact symptoms.
mm-hmm,
And it's very hard to know the difference. I think that there are many women out there who had heart attacks at home and didn't know it because they thought it was an anxiety attack,
yeah,
right? So
for
in
sure.
our office, we are very aggressive about screening for the the risk factors. So if 50% of the time, the first symptom that you have a cardiovascular problem is sudden death, 50% of the time. Over 60% of patients have 0 or 1 conventional risk factor. So we think we know what causes this. We think we got it handled. We think, oh, yes, I can tell you have high blood pressure, diabetes, and you smoke. You're going to be a heart attack waiting to happen. Well, that's true. But people without without diabetes, who don't smoke, who don't have high blood pressure, still have heart attacks. We're barking up the wrong tree in most cases, and that's because conventional medicine hasn't caught up with the literature that tells us that the leading triggers of atherosclerosis are oxidative stress and inflammation. And I have leading indicators in blood, urine, and saliva that tell me that the patient's at risk. And two of those markers are, well, they're all done by Quest Labs, by Cleveland Heart Labs, by Boston Heart Diagnostics. They're conventionally available. They're not always covered by insurance, but they're not terribly expensive. And two of them are called myeloperoxidase and LPPLA2, which stands for lipoprotein associated phospholipase A2. It's a big, long word, and it means it's an enzyme. An enzyme is a catalyst that makes a reaction happen faster. And these are both made by white blood cells when white blood cells are angry. When white blood cells are angry and they're angry inside the blood vessel, inside that intima media space, we measure LPPLA2 elevated. But guess what? LPPLA2 is also in gum tissue where there's blood vessels, where there's bleeding, where it's angry. So if you
Mm.
brush or floss your teeth and you get pink in the sink, to me, that's a 911 dental emergency. You need to get you to your dentist right away, because every single one of my patients who's had a sudden shift in their cardiovascular risk has had a dental problem. It's either periodontal disease, advanced gingivitis with gum inflammation, or a tooth root infection that resulted in those bacteria at the bottom of the root canal tooth getting in the bloodstream and causing plaque rupture. Wow, that's amazing and terrifying all at the same time, right? To know
Yeah.
that toothache could trigger your heart attack.
Yeah, when, the many things that I get very passionate about and like to share about, that was a big one, because I was already like doing, risk factor testing about blood flow issues, because blood flow is the number one predictor of Alzheimer's disease. And I was doing it kind of from like the brain angle, but that's why I love talking to you, because you understand the brain and the heart very, very, very well. But so I did the dentist thing and they were like, you literally have the gums of like a 70-year-old man. And I was like, oh, what? And they wanted to like do surgery, which I was just, I mean, I couldn't pay for it anyway, let alone like the pain that it was going to cause. And then that's when I saw one of our favorite people. He's also a practitioner in Atlanta. And we discovered that I had heavy metal toxicity and mold. And as soon as I treated that, which took 8 weeks, I eventually went back to the dentist, and the regular dentist, not the gum doctor who told me I had the gums of a 70-year-old man at 33. And they're like, "Oh, I'm so glad to see that you ended up getting that very expensive, very painful gum surgery. Your gums look so much better." And I was like, "Nope." It's like,
Right,
actually, I addressed the root cause, and I'm just here for my cleaning, and we no longer have to talk about my gums.
right. So, what a fantastic story, because you not only reduced your risk of heart attack and stroke and diabetes and pancreatic cancer and head and neck cancer and preterm birth and stillborn, should you ever get pregnant. All
Wow.
those conditions are, and 50 some other more, are associated with gum disease bacteria. And in your case, the inflammation was set up by a toxicity burden and an environmental toxin. And so until those things are identified and corrected, we're going to have a really hard time correcting the underlying root cause, because in you, it manifested just as puffy gums. But what if your first symptom was high blood pressure? What if your
Exactly.
first symptom was a heart attack, right?
Yeah.
And
And I
nobody
was,
looked in your mouth. They wouldn't have
yeah,
known that that was the trigger.
especially a conventional doctor, because I've been always told, like, "Oh my God, your blood pressure is like almost perfect, but like on the low side." And I'm like, "Well, I guess that's better than high." Like, I don't know.
Right.
But it's just crazy because I know so many people who, like, the blood pressure is the first thing that they're concerned about. And then they start putting more pieces together. And that's why I tell people, like, flossing and getting your teeth cleaned is like the best thing you could do for your entire health, because everything starts with your mouth. So I'm sure we would love to learn a little bit more from you just about the mouth stuff, because I'm sure people are like, "Oh, I go to my dentist twice or 3 times a year. Everything is fine." But now I'm learning this stuff, and I kind of feel like I need to know a little bit about what's possibly going
Yeah, so
on.
let's talk a little bit about oral health and blood pressure connection.
Mhm.
So first of all, we know that there's this miracle mouth molecule called nitric oxide. It's so important, it won the Nobel Prize, right? It is a gaseous signaling molecule that regulates everything from blood pressure to blood sugar to your immune system and more. And this little molecule is made all kinds of places all throughout your body, but a majority of it is made in the floor of your sinuses.
Mm.
Okay, so this enzyme is made, nitric oxide synthase is the enzyme, but the enzyme is just a catalyst to make a reaction happen faster. And the nitrate to nitrate happens on your tongue. So you have to have friendly, healthy mouth bacteria on the crypts of your tongue in order for this enzyme to do its job to make nitric oxide. When you don't eat enough of the nitrate containing vegetables, and the top two on that list are red beetroots and arugula. So those are the top two nitrate foods. So we love people to eat those foods if they can handle them from oxalates and other reasons. Um, then then we make enough nitric oxide. If we don't have enough nitric oxide, we will have hypertension, guarantee it.
Mm.
And over time, young people tend to make a lot more nitric oxide than older people. And that's one of the many reasons why high blood pressure is seen more as we have more birthdays. So one important thing that your mouth does is convert nitrate to make this enzyme called nitric oxide. Another important thing that your mouth does is it controls your breathing. And if we go to CPR class, they tell us the most important thing are your ABCs: airway, breathing, and circulation. And if your airway is not open, you will not have good blood pressure because you will be strangulating your organs. How do I know if my airway is not open? If I snore at night, my airway is probably not open.
Yeah.
If I walk around all day breathing like this, with my chin forward, forward head posture, and my jaw open, I am probably having an airway problem. And I've compensated for it by putting my head in such a way to open my airway.
Wow.
When you have a restricted airway, you raise your blood pressure. You lower your oxygen flow to all of your critical organs, your heart, your brain, your pancreas, and you end up with complications, including higher risk for Alzheimer's, higher risk for heart attack, higher risk for stroke, higher risk for kidney failure. So we have to make sure that our airway is good. And while obese people often will have large, thick necks and a higher risk for sleep apnea, many, many, many young, thin, underweight people will still have airway problem and sleep apnea. I grew up in a time when it was very common for us to have 4 perfectly healthy teeth pulled as part of orthodonture. They would say to us, "Oh, your jaw is just too small and you don't have enough room for all those teeth. So we're going to pull those teeth out and then we're going to put you in headgear to smish your face backwards to correct that overbite that you have. In doing so, removing 15 millimeters of space that my tongue used to have, guaranteeing that after menopause and all my tissues got a little floppy, that I would develop sleep apnea later in life." And there's a whole generation of people just like me that had this retro something, they call it dental orthodonture, where they pulled our jaws backwards to make room to make a better smile. And they did
Wow.
the best they could at the time that they knew it, but they made our airway too small. And now I'm suffering the consequences. So it turns out that there's all kinds of oral devices that you can put your child in. If they have crowded teeth, I guarantee you their airway is too small. So we can put them in these little, they sort of look like a fancy pacifier. One brand's called a Myo Munchie, and it just is something that they stick in their mouth and they chew on it when they're doing homework or watching TV, and it helps to strengthen their jaw muscles and make larger jaws so their teeth get straight without the need for orthodontures, and they have enough space for their airway. So
So
we can
cool.
prevent it. And getting your child, I would never, ever, knowing what I know now, take my child to an orthodontist without asking the question, what are we going to do about their airway? Are you an airway focused orthodontist? Are you going to help not only straighten my kid's teeth and make a pretty smile, but functionally give me the best possible airway so that my kid doesn't suffer? Because you know what one of the most common symptoms of sleep apnea in children is? ADHD. And the second most common is bedwetting. If you have a kid that wets
Wow.
the bed and has ADHD, they should have a sleep test. No child should ever be prescribed anti-ADD medicine until they've had sleep apnea ruled out.
100%. Yeah, I remember being actually quite surprised that my sleep apnea test came back pretty good, pretty healthy, because I was wondering about that. And so I heard that it's your back of your airway should be an inch and a half across. Is that right?
Um, I don't know. I actually don't know the exact number. I
Okay.
think that the size of the airway is somewhat dependent on the shape of the tonsils and the uvula as well. So I don't think
Mm,
that it necessarily is an exact number. I
okay.
think it's functional and how well you're moving air for your body size. I mean, a 6 foot, 7 foot tall man, an inch and a half might not be enough for his size, but I'm only 5 feet tall. An inch and a half might be more than I need, right? So I think that there's not an exact number,
Okay.
but we do know that when you open your mouth, if you look in a mirror and you can't see that little boxing bag uvula that's hanging down, if you can't see that when you open your mouth, that's called a Mallampati 4 score. You have about, I think, a 90% chance of having sleep apnea. But if you
Wow.
open your mouth and you can see your whole uvula and your whole airways wide open, you probably don't. But you could still be tested if you have symptoms.
Yeah, I got tested just because I like to sleep and I wanted to make sure that I was actually getting the sleep the whole time.
Yes.
Because when you do learn about, I mean, sleep is like everything. Like if you're not getting good
Everything.
sleep and you're not getting good water and you're not eating well, like everything else in your life is just going to be like super, super, super hard. And the mouth, when I learned more about the airway and like the mouth breathing stuff, and again, we used to have that saying, right? Like, oh, they're such a mouth breather, like basically putting that person down. And I was like, what does that mean? What is a mouth breather? And then I started freaking out and I was like, I need to just like get tested for this to make sure that there isn't a
Right.
problem because we don't want to leave any rocks left unturned. And that's why
Right.
it's important to like advocate for the right testing to get done, the frequency of the testing to get done, and being able to talk to your doctor about it, right? Like who's going to be an advocate for you and who is on the same team with you and wants to co-create health with you and
Right.
vitality.
Often you can get a sleep test covered by your insurance.
Mm-hmm.
Um, in my office, we do a home sleep test that patients pay cash for. It's $250, and that includes a reading by a board certified sleep medicine specialist to go over the data. And then I go over it with the patient as well and show them the fine details about what their sleep apnea tests mean. It used to be that the one and only treatment that I had for sleep apnea was a CPAP mask. And many patients would refuse to even do the test because they'd say, there's no way I'm wearing a CPAP mask. I've seen them. I don't want to go through the rest of my life looking like an elephant in bed at night because of that tube that connects,
Yeah.
brings oxygen to their face. And guess what? I have at least 6 different treatments for sleep apnea that don't involve a CPAP mask, depending on the severity of the case. We can do things like lip taping, literally using tape to close your lips at night if the only problem that you have is that you're a mouth breather and that causes you to snore. By the way, snoring leads to a dry mouth that changes your pH, that changes your oral mouth bacteria, that leads to a bacterial overgrowth of the wrong kind of bacteria that can't reduce nitrate to nitrate, that don't allow you to make nitric oxide. So if you're breathing in your mouth open all day long and all night long, you're going to have high blood pressure because your mouth bacteria are off. So let's zip your lips closed with tape at night, and I can cure that problem. So mouth taping is one. Some people wear nasal splints. They look like the little clips you used to wear on your nose when you would go swimming, but they go inside your nostrils instead and hold your nose open instead of pinching it closed. Nasal
Oh,
splinting is another option for some people. For some people, they only have sleep apnea when they sleep on their back. And they don't have sleep apnea if they're on their right side or their left side. They only have it on their back. So guess what? We find a way to not let them sleep on their back. A low tech solution is to take an old sock, put a tennis ball in it, and tape it, pin it, safety pin it to the back of your pajamas so that when you roll over in bed at night, you're sleeping on a tennis ball and you won't stay on your back very long. But they also sell backpacks with the inflatable baffle between your shoulder blades
oh my gosh.
that you can't roll over onto your back, right?
So cute.
Simple strategies that are not CPAP mask. There's oral myofunctional therapy. This is like physical therapy for your jaw, lips, and tongue to retrain your body so that it knows the proper position of where your tongue should be if you train it during the day, it'll stay that way at night. So you practice these strategies using little buttons on strings and little flippers in your tongue and all these things that they do with their exercises, clicking, some kind of things to help retrain your tongue to get it in the right place. And then
So
the big
cool.
one, the ace up my sleeve, which I have not had to prescribe yet, but is always in the back of my mind, is something called maxillomandibular advancement surgery. It's a big gun, and we don't need to use it if we don't have to. It's where they literally, surgeon goes in and cuts your cheekbones in half, cuts your jaw bones in half, puts bone grafts in, advances your entire front of your face forward a few millimeters to a few centimeters, depending on what you need, puts plates and screws in there to hold everything. Then you have to wear braces to close up all the teeth spaces that they made because they opened your jaw up. But in doing so, they can dramatically change the airway and your future by keeping your nitric oxide levels normal, your blood pressure normal, and your brain, heart, and lungs getting oxygen while you breathe at night with no CPAP mask required. MMA surgery is curative over 95% of the time for sleep
Wow.
apnea, and it's covered by 95% of insurance companies. So it's a big gun, but it's out there as an option for people who try and fail some of these other strategies.
That's incredible. Do you have any insight into sleeping on your left side versus your right side? Because somebody is in my algorithms trying to convince me which way is better.
Yeah. So most people, it doesn't matter.
Okay.
For some people, it matters a lot. If you have heartburn or hypertension, sleeping on your left side can take the stress of your internal organs off your aorta. Or while you're pregnant, we often will have women sleep on their left side because that will help de-stress the major organs on the inside just from the weight of your body's own baby that's growing there, or organs. If you have heartburn, sleeping on your left side can keep your stomach contents in that pouch of your stomach better than lying on your right side. But for most people, it probably doesn't matter.
Okay. Thank you. It's like been stressing me out. I like wake up and I'm like, oh my God, am I on the wrong side? That is so amazing. I love that. Well, this has been amazing. You've shared so many things. I can't wait to like re-listen and like take notes for myself because there's just so many juicy nuggets. And I'd love for you to just show us your book. And I'll
Yes.
put a link below so you guys can get it. But it's the Blood Pressure Blueprint, the holistic guide to defeating hypertension. And I love you said heart attacks are optional. Strokes are stoppable. Dialysis is not your destiny. Amazing. I don't even, everyone has like words that like creep them out.
Yes.
One of my words is dialysis. Like it really creeps me out. I don't even really understand what it is, but like it really freaks me out.
Yeah. So interesting you mentioned that. In August of 2025, I am the conference chairman for a conference in Atlanta in Buckhead called Cracking the Code on Chronic Kidney Disease, the Identification and Reversal of Chronic Kidney Disease.
Cool.
In integrative medicine, we know that we have patients who used to have asthma and don't anymore, who used to have diabetes and don't anymore, who used to have psoriasis and don't anymore, that we have been successful in curing and reversing chronic illness. In conventional medicine, nobody believes that chronic kidney disease can be stalled or reversed, and it's not true. We see people, there will be lecturers at my conference who have had people on dialysis who no longer require dialysis. What is dialysis? Dialysis is a treatment that replaces the function of your kidneys. It takes your blood or other body fluid out of your body, runs it through a dialysis machine, cleans out all the toxins, and runs your blood back in. There's also a home peritoneal dialysis where you can inject a fluid into your abdominal cavity, let it sit there for a few hours, and suck the fluid back out again, taking out the contents of toxins that your body has built up that your kidneys were supposed to filter out, but no longer can do because they have failed. We now know that there are many identification risk factors that we can control, including high blood pressure, high blood sugar, stress, oxidative stress, inflammation, all the same things that lead to heart attacks, strokes, and Alzheimer's disease. These can all be managed and controlled, and they help kidney disease improve as well. So diabetes is the number one leading cause of kidney failure that leads to dialysis, but we know that you have great power to exercise and control what goes in your mouth and how you get your blood sugars under better control. Same will do for your blood pressure, same will do for your oxidative stress, same will do for your inflammation. And you have to be in a team of health professionals that include a dentist, a hygienist, and a medical doctor or similar professional.
Wow. Thank you for explaining all of that.
You're welcome.
That's so funny because one of the things that I really, really had to work on when I was doing my big body clean out healing was my kidney. So I guess maybe that's why I've always been a little drawn to that.
And interesting, in traditional Chinese medicine, kidneys hold fear.
Yeah.
So when we are living in a state of terror and fear, often our kidneys will start getting sluggish on us. So there's often an emotional healing component and some trauma work that we need to do to help with our kidneys as well. And we'll be talking about that at the conference too.
I love that. Yeah. Our mutual friend, Oscar Sierra, Chinese medicine doctor, is the one that told me about the kidney stuff that you just shared, the fear stuff. And he just asked me a question, like as he does, as his intuitive little self. And then I immediately answered, and I was like, did I just say that? Like, he's basically like asking, like, what the real fear, anger thing was. And then it came out of my mouth, and I was like, wow, amazing. And then for a substantial amount of time, I did acupuncture with him. And then I did any and all of my meditations. I was literally picturing my kidney dropping more so into the place of my body where it was supposed to be. And that was like a huge thing in itself, right? And that's why I love like, energy healing and acupuncture and like all these things, because if I hadn't have involved that, and if, my practitioner hadn't have been like, hey, you know what the kidney is responsible for? We need to talk about this, like not your therapist, but let's figure it out. And then I was able to process it in a way that makes sense for my body. So I really appreciate you sharing that, because I think that's a really important piece when we're talking about holistic. It's like truly everything interconnected and having the best team.
Yeah. Yeah. So I think for your audience, my most important message is that women suffer heart attacks just as often as men do. We have different symptoms. They're not dramatic. They should not be ignored. We need to advocate for ourselves. Make sure that the doctors are you doing a heart attack workup? I need to have a heart attack workup. And there's some blood tests and EKGs and things that they'll do that's standard of care for everybody, every patient having a heart attack. And if you're not having a heart attack, great. Go home from the emergency room and then go find an integrative practitioner who can take a deep dive into your risk factors and find out if you have hidden risk factors in oxidative stress, inflammation, or advanced lipid tests not done by your regular doctor that can identify that you might be at risk. And we can turn that ship around and correct it and make sure that you never have to suffer a heart attack or stroke like the patients in my practice are not suffering.
Amazing. And if you are in the Atlanta area or you want to go to Atlanta for a little trip for yourself, like, cannot recommend going to see Dr. Ellie Campbell enough. She has the cutest little office, not in the city, so don't worry about that. And I mean, I've been referring patients to you since the first day I met you 13 years ago. So I know the power that it is when people work with you. And I mean, you helped one of my best friends who had all kinds of crazy stuff going on, heart disease, diabetes, cancer, like all the crazy things. And she's very young. So I'm just so grateful that you do all the amazing things that you do for all of the different ailments and really just helping people set a new standard of care. And I love that you said conventional medicine standard of care, because those are the words that I sometimes like forget to use. But that's what this is about, this journey, right, that we're all on, is like we have to change the standard of care, and we're going to do that by advocating for ourselves. And I
Right.
know that women advocate for ourselves very well. We especially advocate for the men in our life, the children in our life, and we need to keep that going so that we can change some of these statistics when it comes to heart attacks, because I mean, it's literally like heartbreaking to learn some of this information. So please share this with a friend. And if you're curious and learning more, highly recommend getting Dr. Campbell's book. I'll put the link below. And as always, anyone who you love, whose book you got on Amazon, it helps so much to leave a review. Amazon does not like me. They will not let me leave a review on any of my friends' book. And I am still processing whatever the spiritual lesson is about that. And so I really appreciate everyone being here. Thank you so much, Dr. Campbell. This was like absolutely amazing, wonderful. So glad to see you.
You
So
as well.
grateful for all this information. And also just let us know what resonated, and let us know in the comments what you need for support, and we'll be sure to send you the resources that you need. Awesome. I will see everyone next time, and I love you all so much.